Madam President, today I rise with great concern concerning a program that was just revealed in the Sunday New York Times. Outstanding work by Mark Kirk called U.S. Plan Stealth Survey on Access to Doctors. I'm asking my colleagues to join in a letter to Secretary Sebelius sharing concern with the legality, standards, and repercussions of this program. I have deep concerns regarding the Department's recent plans for this so-called stealth survey, its legality, the notification to Congress, the lack of standards for any misconduct or bad reporting by the staff hired to carry out this work, in looking at clandestinely at American doctors and their practice of medicine. The cost and proposed clandestine method of collecting information on physician offices is questionable, and therefore I'm going to be requesting details on how this survey will be conducted, how investigators will be punished for any misconduct or extortion that they may carry out in their duties, and how patient and physician confidentiality will be maintained. In our letter, we're outlining 12 key questions. First, since there are already a number of surveys answering this question, does this expenditure of taxpayer money add anything? We're asking for the Department to provide detailed records of their literature review on the current research that has already been published on the subject before launching this taxpayer expense. We're also asking for the total cost of this program to be revealed. Second, we're asking for records on how the National Opinion Research Center of Chicago, Illinois, won a federally competitive bid to carry out this work. Number three, in concluding the results of this survey, how will the NORC decide what qualifies as an acceptable response or best practice from physicians that they have targeted? Number four, how will patient and doctor confidentiality be maintained? If researchers report bad information or use the survey for extortion, bribery, or other acts, how will they be disciplined? Number five, once concluded, who has access to this information? The Department, the White House, the Congress, the press? Number six, by what criteria will individual physicians be targeted for participation? Will age, average incomes surrounding office locations, or political affiliation be excluded from factors considered when targeting physicians? Number seven, will federal employees carry out this work, or will it be conducted by a contracted call center for data collection? And who is qualified to conduct this survey, and how will they be chosen? Number eight, if the staff improperly releases patient or physician data, how will they be disciplined? Number nine, I'd like their description of the FY11 Appropriations Committee program or account number on which this was funded. Number 10, I also want to describe the statutory authorization used to carry out this work and provide the congressional notifications informing the committees of jurisdiction of their intent to obligate funds for this purpose. Number 11, also asking for specific sections identified in the President's budget under which the funding for this work was requested. And number 12, if a physician wishes to correct data collected by the NORC, what legal redress does he or she have? Now, there have been a number of very reliable studies which confirm that many patients on Medicaid and Medicare cannot find a doctor to see them. Previous studies also confirmed that we do not have enough doctors, particularly primary care doctors. And we all know that government programs often provide poor service and suffer from funding failures or corruption. In this time of serious fiscal constraints, I would urge us to focus our limited federal resources on ways that we would actually address these problems, rather than launching another taxpayer-funded spending program to clandestinely review the work of our physicians. And Madam President, with that, I yield back and suggest the absence of a quorum.
Clerk will call a